My name is Brian Gallinet. I'm an orthopedic surgeon here at Christiana Care Health System. I'm also chairman of the Department of Orthopedic Surgery and leader of the Musculoskeletal Service Line. Well, shoulder pain is common, we know that, and the more common things that cause shoulder pain involve inflammation. Itis means inflammation. Inflammation of the bursa, bursitis, is very common in the shoulder. Inflammation of the tendon, tendinitis, right next to the bursa, and then down underneath the tendons is the joint, arthritis. Those are three common causes of shoulder pain. The rotator cuff is what we were referring to when we were talking about bursitis and tendinitis. There are actually 18 muscles that help you raise your arm up overhead. 4 of those muscles come from the shoulder blade. The shoulder blade muscles transition to tendon, and the tendon attaches to bone. These tendons blend together and surround the shoulder joint like a cuff and help rotate the arm in and out, hence the name rotator cuff. The back part of the shoulder blade, there is a spine of the scapula. The muscle above the spine is the supraspinatus muscle. That particular muscle, as part of the rotator cuff, is the one that's most commonly worn out or injured. The attachment to the bone can be compromised. That would be a rotator cuff tear. People that need rotator cuff surgery are the people who did not respond to non-surgical management of their rotator cuff issues. Non-surgical management may include anti-inflammatory medicines, physical therapy, modification of activities, perhaps an injection. If you still have an interference with what you want to do on a day-to-day basis in spite of extensive non-surgical management, it's at that point in time where the discussion of surgery can be had. When the rotator cuff is no longer attached to the bone, when the tendon attachment is compromised, we need to try to reattach that tendon back to the bone. That process is slow. The healing of a tendon back to the bone takes about 6 to 8 weeks. The actual mechanics of reattaching the tendon to the bone would involve placing sutures on the edge of where the tendon is torn, passing those sutures through the tendon, wrapping them over the tendon, and trying to hold the tendon back to the bone so it will biologically heal in a manner that will allow us to again use all the muscles around the shoulder to help elevate the arm. I would like it that people never had shoulder pain. So again, I would emphasize on doing good exercises and avoiding bad exercises. The good exercises are strengthening the muscles of the upper back so that those muscles help support the arm when we use them up overhead.